optimistic that I won't require much, if any, anesthesia. It'd be neat to be able to have this work.
Dr. Michael Seidman is a Henry Ford physician, as well as medical director of the Center for Complementary and Integrative Medicine. After a wakeboarding accident, he tore his right anterior cruciate ligament, or ACL. Now, he will require a complicated reconstructive knee surgery. But unlike typical patients, Dr. Seidman wishes to undergo the procedure without general anesthesia, mostly relying on the therapeutic powers of acupuncture and his own mind.
Peaceful, relaxed, confident, and comfortable. So whenever you're ready, you can turn your switch off and you can open your eyes and bring yourself out.
The acupuncturist, Ramon Nunez, connects a small stimulating device to the acupuncture needles, increasing the numbing effect. At the same time, Dr. Levine, himself a hypnotherapist, will help mentally prepare Dr. Seidman for surgery. While Dr. Seidman is confident in the effectiveness of acupuncture and his own inner strength, an anesthesiologist will give pain medication as needed to ensure his comfort and safety.
I told him I'd be willing to work with him and ensure that he was comfortable and that his body wouldn't take on any undue stress. And I would intervene with a general anesthetic if necessary.
And with his leg prepped and the surgical team ready, this incredible operation will begin. The 2-hour surgery will now be in the hands of his surgeons, Dr. Kyle Anderson and Chief of Orthopedics, Dr. David Collin.
Starting.
0 to 10, Michael. He'd like some feedback.
About a 3 or a 4. It's pretty sharp, but not bad.
Okay.
I don't feel like he's doing anything to me.
Very good. Things are happening, so it's very good.
Excellent.
At this point, Dr. Seidman is completely awake.
Is this my knee or somebody else's knee you're operating on?
We're just showing you this is a trick. We're just showing you someone else's video.
It's pretty awesome. Come on in.
As the surgeons reach the inner bone, the pain intensifies.
Feeling some discomfort.
Let's see my number.
About a 7. Occasionally, right knee.
Okay, you coming down?
Right knee, right knee. Yes, it is. Ow.
The team questions if Dr. Seidman will be able to go on.
Relax.
You do feel this?
No, peaceful, confident, relaxed. It's just what the bend of my knee is what's most uncomfortable, frankly.
But with Dr. Levine and Ramon at his side, Dr. Seidman is determined to continue.
And you can have those feelings. That's not a problem. It does not affect who you be, right? There you go.
And when you accommodate, you're accommodating to just feeling the stimulus, not the anesthetic effect. We got through the worst of it, Mike. Now we're closing.
With surgery complete, Dr. Seidman is overwhelmed by his remarkable accomplishment. Dr. Anderson shares in his achievement.
Well, I was very skeptical that we would be able to get through this without providing him essentially general anesthesia. Now, having gotten through it, I'm really impressed with him. I think that a lot of this was his desire to be able to get through this and his ability to put pain out of his mind.
You know what? I thought we would make it through the knife hitting the skin. I thought we would make it through the first 10 minutes or so. I did not believe we would make it through the entire procedure of harvesting the graft and drilling the bone and putting in bone screws and so forth.
You know, as a scientist and a physician, I've read about this. I know that it works. And part of me was chicken to do this because I thought I'd have pain, but I knew I had a backup plan. And I'm just thrilled to death that I didn't have to use it. It was amazing.
And less than 2 weeks later, he's back at work, recovering even faster than expected.
Well, I was back to work 8 days after surgery, so yeah, they usually say that people take anywhere between 2 and 6 weeks off, depending upon what they do. 2 weeks for a desk job, and I don't have a desk job, I move around a lot. So they thought I might be pushing it a little bit, but I've actually done quite well. Interesting, when I talk to most people and I said what I had done, they look at me as though I was absolutely crazy. And they say, you know what, just knock me out. And so this is not something for everybody. And it takes, you know, the right hypnotherapist and acupuncturist and the right patient, I think, to make it work. And it worked well for me, so I'm just pleased.